Did you think that your symptoms would stop after menopause, but now you're wondering why they're coming back? Women are continually surprised that their symptoms return after menopause, even when they are on hormone therapies. No one seems to be talking about this though. You know, what happens after menopause? Welcome to post-menopause, a stage that we are now in for the rest of our lives. Yet many women tell me they feel like their symptoms are returning all over again. But if we are through menopause, then what's going on? If this sounds like you, then listen up for a few minutes. Post-menopause is defined as the stage when you've gone 12 months without a period. You might think that means the symptoms are over, but for many women, that's simply not the case. Instead, from the 500,000 women who've taken the symptoms quiz, I know that many in postmenopause are feeling more breathless, they're struggling with weight gain, experiencing a return of brain fog, hot flushes, aching joints, or just a sense of fatigue that never lifts. And what's worse, these symptoms are often dismissed by medical professionals as having to be accepted as just part of our aging. But is this really true? Hi, my name is Dr. Wendy Sweet, and for the last 2 decades, I've studied women's healthy aging and helped over 20,000 women adjust to menopause and post-menopause using scientifically evidenced lifestyle changes. Over this time, I've learned that the most common symptoms occurring in postmenopausal women are weight gain, especially around the middle, despite eating well and exercising, hot flushes or night sweats that have returned after not occurring for a while, especially for those women on HRT, brain fog and memory lapses that make women feel concerned about early dementia, especially if their mothers have experienced this, restless or aching legs and joints, often worse at night or after exercise, and many think that this is early onset arthritis, heart palpitations, dizziness or chest pain, breathlessness, low mood or anxiety without an obvious cause, and just a general sense that your body isn't bouncing back the way it used to. Many women are also seeing shifts in their cholesterol, blood pressure, bone density, and are being told that this is normal due to aging. When we become worried about our changing health, it can feel like a minefield of information, and it's hard to know where to start. But if you think about it, the postmenopause years are a return to our pre-puberty hormone levels. Postmenopause brings a continued decline in estrogen and progesterone, and this impacts the aging of your heart, brain, bones, joints, gut, and immune system. In women's health and longevity studies, these changes occur due to inflammaging, or the chronic low-grade inflammation that characterizes aging. If women aren't sleeping well or not putting in place the right lifestyle changes, then these inflammatory changes can accelerate the rate of aging. As such, symptoms return or new ones appear, or for many women, their weight and heart and immune health start to change too. It's also around this stage that many women also begin to ask, should I be coming off HRT? And while that's a personal decision between you and your doctor, what many women don't realise is that there are specific lifestyle changes that can help the body adapt to the postmenopause years without HRT. Supporting your liver, gut health, sleep, inflammation, and restoring hormonal balance naturally can make a huge difference. That's why it's not just about stopping HRT, it's about preparing your body for the transition to the next stage of your life. Many women I work with tell me, I just want to feel well enough to travel, play with my grandkids, and finally have time for myself, and you deserve that. Postmenopause isn't the beginning of decline. It can be the start of a powerful new chapter in your life. That's why I developed Beyond Menopause, a 12-week lifestyle program that helps you understand what's going on inside your body and teaches you science-backed solutions to support your heart, brain, bones, joints, and energy in this next stage of life. It's trusted by thousands of women, and it's designed to help you feel like yourself again with the knowledge, structure, and support to get there. So if you're experiencing symptoms after menopause and wondering why no one is talking about it, please know this: you're not alone. If you would like to understand more about your symptoms, then you can start by taking my symptoms quiz, which I designed as part of my PhD studies. When you understand what's going on inside, you can take action, and that's what I want to help you with. Then the Beyond Menopause 12-week program is your roadmap, outlining the specific lifestyle changes you can make to restore your health, longevity, and vitality in this next chapter and new beginnings of the rest of your life.